Aloha from Honolulu, Hawaii. I'm Monica Herrera, the Women, Peace, and Security Curriculum Developer at U.S. Indo-Pacific Command. Our Office of WPS also includes our Command Gender Advisor, Sharon Feist, our Gender Analyst, Dr. Dee Sawyers, and our WPS Planner, Charity Borg. On behalf of Indo-Pacific Command, we're pleased to welcome you to this Women, Peace, and Security webinar. Today's event is the second in our WPS Quad Series, co-hosted with Pacific Forum. Our topic today is military-civilian medical support, why women matter in crisis leadership, decision-making, planning, and response, featuring expert panelists from Australia, India, Japan, and the United States. I'd like to thank our esteemed speakers for being here with us today. Your perspectives and expertise are critically important to better understand how defense sectors across the Indo-Pacific and around the world can leverage our collective experiences to strengthen the WPS agenda together. Women, Peace, and Security continues to evolve within the U.S. Department of Defense, and U.S. Indo-Pacific Command is fully committed to advancing the department's implementation of our U.S. national strategy on WPS. We recognize the importance of applying a human-centered approach to security, one that's inclusive of the roles, perspectives, and contributions of both men and women across the crisis continuum. And we're grateful to work alongside like-minded nations, like those represented here today, who understand the value of WPS in creating more stable, secure, and prosperous security outcomes. We look forward to continued growth and progress in WPS and encourage all interested stakeholders to think of U.S. Indo-Pacific Command as a fully invested partner in advancing holistic and inclusive security. Strengthening our cooperation on WPS through events like these will ensure we see an Indo-Pacific region that is free and open for all. Thank you for joining us today for what's sure to be a robust and insightful discussion. I'll now pass it over to David Santoro with Pacific Forum.
Thank you very much. Aloha, good morning, good afternoon, and good evening. Thank you for joining us here today for our second Women, Peace, and Security quadrilateral webinar on military, civilian, medical support, why women matter in crisis leadership, decision-making, planning, and response. My name is David Santoro, and I'm the president of the Pacific Forum, a Honolulu-based research institute focused on defense and security policy in the Indo-Pacific. So today we've gathered leaders from each of the Quad countries, Australia, Japan, India, and the United States, countries with like-minded visions in advancing a free, open, and inclusive Indo-Pacific. The Pacific Forum is pleased to hold this webinar in partnership with the U.S. Indo-Pacific Command to explore the critical role of women in joint military, civilian, medical support efforts. This webinar is an opportunity to consider how women contribute to HADR response initiatives during crises, such as COVID-19 or Ebola, as well as other disaster and humanitarian scenarios. Over the next 90 minutes, we will discuss best practices in military, civilian, medical response, and the importance of sex disaggregated data for gender-sensitive analysis. And there will be an opportunity for our panelists to share their experiences. Perhaps most importantly, we hope to underscore how our shared values foster secure, resilient, and inclusive societies. Therefore, we are highlighting the Quad countries' effort and their commitment to women, peace, and security in the Indo-Pacific. Now, a quick note on the format. Please be aware that today's discussion will be recorded for sharing public dissemination in the near future. The discussion will be moderated by Mr. Arush Lal. Mr. Lal is the board vice chair of Women in Global Health, and he is an MPhil PhD candidate in health policy and health economics at the London School of Economics. His research focuses on advancing understanding on the politics and governance of global health security, and on priority and agenda setting at the nexus of global health security, universal health coverage, and health equity. Mr. Lal is also a consultant with the Pan American Health Organization. So before I hand it over to Mr. Lal, I just want to stress that if time permits, we will open the floor to participants for Q&As at the end of this session. And so with that, I'll hand it over to our moderator, Mr. Arush Lal, to kick off the substance of today's program.
Thanks so much, David, for the kind introduction, and Monica as well for your opening remarks. So just as a quick, I'll first kind of go through the ground rules and logistics, and then I'll introduce what the session is about for today. A brief note, this session features simultaneous interpretation, and you may access the English or Japanese channels using the globe on the bottom right portion of your screen. A quick reminder, speakers, please do speak slowly and clearly so that the interpreters can make sure that they're speaking correctly. Also, some brief ground rules. Note that the remarks made in today's program are on the record, as video and audio recording of the session will be made available on the Pacific Forum website and on Indo-Pacom's and Pacific Forum's YouTube channel in the future. We'll also have a post-event survey, and we'd like you to complete after the event ends. A quick recap of where we are in this session. This is the second in our two-part WPS Quad series, the first of which was Rising Together, How the Defense Sector Advances Women, Peace, and Security webinar. The first event celebrated the 20th anniversary of the UN Security Council Resolution 1325 on women, peace, and security, and was held in late October. This webinar underscored how our shared values foster secure and inclusive societies. It also emphasized how a free and open Indo-Pacific enables new opportunities for previously untapped resources, innovation, and leadership, while highlighting all four countries' expressed commitments to promoting women, peace, and security within the Indo-Pacific region. Speakers highlighted the importance of women, peace, and security agenda for armed conflict, maritime security, and disaster response, national progress towards implementing WPS in the security sector, remaining challenges in the implementation of the WPS agenda, and finally, their personal experiences as women in the military. Today's session will consider how women contribute towards humanitarian assistance and disaster response initiatives during crises such as the COVID-19 or Ebola pandemics, as well as other disaster and humanitarian scenarios. We will discuss best practices in military civilian medical response and the importance of sex disaggregated data for gender-sensitive analysis, and there will be an opportunity for our panelists to share their real-world experiences. So moving on to our speakers, I would first like to introduce Ambassador Williams. Ambassador Stephanie Williams is Australia's ambassador for regional health and security at the Australian government's Health Security Initiative for the Indo-Pacific region. Ambassador Williams, would you like to elaborate a little bit more on your current role in military and civilian medical support?
Thanks for the opportunity to join today. So I have a great job, which is to foster linkages between Australia's premier health and medical institutions and our regional partners, as well as working in the Centre for Health Security, which is committed to building capacity to prevent, detect and respond to infectious disease threats in the region. And at that centre, we have a whole of government reference group and secondments from Departments of Defence. So that's our real interface when we're talking about our engagement in civ-mil cooperation for health and medical response. And we provide advice on some of the ways in which Australia responds to infectious disease outbreaks in the region. Thanks.
Thank you so much, Ambassador Williams. I'll now turn over to Mr. Noguchi Yasushi to introduce himself. He is the Director General for International Affairs at Japan's Bureau of Defense Policy. Please, Mr. Noguchi, discuss your current role in military medical support.
Thank you very much. And I would like to express my appreciation for organizers, US Indo-Pacom and Pacific Forum. My name is Noguchi. I am Director General for International Affairs of the Defense Ministry of Japan. I am the only male panelist participating, so I hope I will be able to contribute to enrich today's discussions. My portfolio is defense cooperation with foreign countries. Particularly, I'm focusing on free and open Indo-Pacific defense cooperation in the framework of Quad. As you already know, there was the first Quad summit meeting in March online, and the 4 countries' leaders agreed upon that 4 countries will cooperate in several fields, including humanitarian assistance and disaster relief. That is why this webinar is very, very timely. And we are democracies, we share the same values like rule of law, freedom of speech, freedom of navigation. And today's webinar focuses on the female military personnel's role in the humanitarian assistance and disaster relief. And I'm sure that this will contribute a lot to achieve the vision of free and open Pacific. And just, I would like to remind you that Quad cooperation started in the great earthquake and tsunami, which hit Indonesia and other countries of the Indian Ocean in December 2004. So that is why this webinar is also very significant. I stop here. Thank you very much.
Thank you so much, Mr. Noguchi. And I do think it's excellent. We need male allies in this mission. So thank you so much for joining. Next, we'll turn to, from the United States, Rear Admiral Pamela Miller is Command Surgeon for the U.S. Indo-Pacific Command. Rear Admiral Miller, please discuss your current role in military civil medical support.
Good morning, good afternoon, good evening, everybody, and thank you very much. So as stated, I currently serve as the command surgeon here at U.S. Indo-Pacific Command, and essentially I'm the senior medical advisor here to the commander of Indo-PACOM for really all health and medical response planning for exercises, operations, HATR missions, DISCA support, really anything. And it's a fantastic job. I've been here since last September. It's the best job I've ever had, and it provides an opportunity to really assist and ensure that we have collaboration throughout the continuum, not only between us and the joint staff for the United States, but also our interagency partners and all of our allied partner nations in the AOR, whether it's planning routine exercises, whether it's contingencies, or whether it's emergency and crisis response efforts. I get the opportunity to work with such a diverse group of professionals. I learn every day, and I'm really excited to be here today in support of this webinar, where we're talking about such a timely, important topic for women, peace, and security as it relates to military civilian medical support, and really the unique contributions that women bring to that effort. But as stated earlier, it's a team of teams approach. We have many of our male counterparts here are on our team at Indo-PACOM, and it's really a whole of response effort. And I really appreciate being here today, and I look forward to the dialogue. Thank you.
Thank you so much, Rear Admiral Miller. And I think your point on team of teams is exactly what's required for this kind of mission. And last but not least, from India, we have Dr. Divya Gautam, who is Surgeon Captain in the Indian Navy. Surgeon Captain Divya Gautam, please discuss your current role in the military civil medical support.
Good morning and namaste from India. And thank you, Mr. Lal. Well, I am Surgeon Captain Divya Gautam, representing India at this very distinguished webinar. I'm a doctor by profession, as mentioned, and I have done my master's in hospital administration. I've been serving in the Indian Navy for the last 26 years, both in clinical and administrative appointments. I have the unique honor and privilege to have served a full tenure on an Indian naval ship INS Jyoti in 1998 to 2000, and was also privileged to be deployed on USNS Mercy when it was on a humanitarian mission to the Southeast Asian nations. I have commanded a naval hospital, and I was at the helm of the School of Medical Assistance for 4 years, where we trained the paramedics from the Navy and the Air Force as the first woman officer since the inception of the school. Currently, I'm with the Office of DG AFMS, which is the cadre controller and the policy planner and we were involved in all plans and for the COVID-19 and policy making. And I'm also looking after the coordination of the very prestigious Indo-Pacific Military Health Exchange, which is going to be held shortly. And I'm happy to be here today at this webinar.
Thank you so much, Surgeon Captain Divya Gautam. Great, so thanks so much for all the speakers for introducing themselves. I'll now briefly explain the format of this webinar and then introduce the first set of questions. So as a recap, each speaker will have the opportunity to provide responses during 3 rounds of questions that explore military, civilian, medical support. As a reminder, please do keep your responses to 4 minutes each. And I'll make sure to keep time of that. So please do be wary of that. And also do speak slowly and clearly for the interpreters. Also as a note, I will again introduce all 3 questions at the beginning, and I'll in the middle of after 2 speakers speak, I'll remind you of the 3 questions just in case. So on to the first set of questions. What is the role? The first question is, what is the role of military medical support to humanitarian assistance and disaster response and infectious disease outbreaks? The second question is, how do military women contribute to this broad role? And the third sub-question is, what are some ways that your organization seeks to include and promote women as participants and leaders in medical support to humanitarian assistance and disaster response and infectious disease crises? Ambassador Williams, I think we'll start with you.
Well, I mean, I'll offer a few perspectives here. So the first one is it was about the role within our organisation and the region, and I have 2 perspectives to offer. And this was thanks to a discussion I had with our Australian Defence Force personnel in anticipation of this event, which was, military medical support for the Australian Defence Force as part of a whole of government response to communities during outbreaks. And certainly during COVID, we have seen parts of our military medical support deployed in country in Australia to various parts of our COVID response with good effect. Part of that offering is the equipment, but it's also the people, specialists and generalists across a whole range of relevant specialties for medical missions and infectious diseases. Now, in Australia, we have more than 50% of the health and medical workforce made up by women, and in that sector, in the Australian Defence Force, that's a similar proportion. Women make up a lot of the health sector within the Australian Defence Force. And as at today, with all roles open to women in the Australian Defence Force, around 19% of the whole force is women. Indeed, I have very personal engagement. I'm a civilian, I'm a public health physician, previous advisor to the Chief Medical Officer in Australia, the former one. But my boss was a Navy military woman and schooled me in many ways. But in the COVID response of 2020, I know that lots of military medical personnel were seconded to our Department of Health to lead and plan and support the whole national response. And all of those secondments that I know of were women. The other perspective is, of course, our commitment to women in infectious disease and medical and humanitarian assistance in the region from the aid policy perspective, but also Australia's whole of government engagement in the world. And gender equality is a core pillar of all our engagement, including focusing on women's leadership in peace and security. But where I work in the Centre for Health Security, we have a commitment to gender equality across our strategic framework. And we see the logic of women as leaders in decision-making, as beneficiaries, but actually mostly as leaders and voices in how things should be delivered. Now, that's fine to have policy. And when it comes to action and how we do that, for example, through our funding to improve infectious disease resilience in the region, in Southeast Asia and the Pacific, that's when I think it's increasingly important to turn our words into results. So we have policies and guidelines, for example, that require, should we be funding a fellowship, that there is an equal opportunity of men and women participating in fellowship opportunities. When we review project fund grant applications, we have a clear view and an expectation of gender equity and equality in the grant applications. Now, they're two small examples. We have a long way to go, and especially in how we work bilaterally in health system development, again, with a principally a development perspective. One of the items of action we have put into our bilateral designs, the agreement, for example, between Australia and the Solomon Islands to improve health systems, is to see women in leadership. Because until we measure and make explicit that goal, it's very difficult to turn our intent into results. I'll stop there.
Thank you so much, Ambassador Williams. I think it's an excellent point, especially your point to make a strategy for gender equality. It is key to institutionalize these kinds of recommendations, and especially to make explicit these in the goals. So thank you for that. Next, we'll turn over to Mr. Noguchi to answer the first set of questions.
Thank you very much. So I will respond to the first question, the role of military medical support to humanitarian assistance, disaster relief. And the Japanese self-defense force should control or manage the health conditions of the personnel, and also should enhance medical capabilities in order to protect the personnel of the lives of the personnel of the self-defense force. In addition to that, the missions and operations of the self-defense force have been diversified, have been more and more globalized, and self-defense force is expected to respond to the needs of medical assistance in humanitarian assistance and disaster relief in foreign countries, and also in international peace cooperation activities. And also, we are required to support capacity building for military medicine. And in Japan, during the pandemic, in order to contribute to the Japanese local health services, medical services, since February last year, the self-defense force has been accepting COVID patients in the self-defense force hospitals. And also, many local governments are suffering from the shortage of nurses. That's why self-defense force has been dispatching nurses to help the local health services in local governments. And also, in May, the Japanese self-defense force has established 2 large-scale vaccination centers, one in Tokyo and the other in Osaka. And they are helping for the vaccine rollout in Japan. And I would like to point out that in these operations to fight against COVID-19, there are many female self-defense force personnel participating. Actually, our percentage of female self-defense force is around 7.9%. But the percentage of female doctors is around 24%. And the female self-defense force personnel are playing a very important role. And also, I would like to touch upon the Japanese participation in Pacific Partnership, which is initiated by US Navy. And Japan participates sending maritime self-defense force ship. And we always assign at least 1 female doctor in the ship in order for women to receive medical treatment and to have consultation. in a relaxed manner. And also in 2018, Self-Defense Force has assigned female Self-Defense Force personnel as a senior position, as a senior officer in charge of disaster management planning to support the defense minister in order to reflect the gender perspective in the planning and decision of disaster management. And also, I would like to point out that it is important to support female self-defense force personnel engaged in humanitarian assistance and disaster relief. And for example, in order for those female self-defense force personnel to concentrate on their duties in their mission for the disaster relief operations, we have been establishing services to take care of their kids or their children inside the self-defense force camp. And in this way, we are trying to create a friendly environment for self-defense force, female self-defense personnel to be engaged in these operations. I stop here. Thank you.
Thank you so much, Mr. Noguchi. And especially, I think I liked your point about supporting the capacity for military medicine, especially given the shortage of nurses that you mentioned. So thank you for raising that issue. So next, let me just quickly first recap the set of questions again for the second two speakers. And feel free to respond to any or all of them, however you feel fit, whichever one you'd like to weigh in on. The first sub question is, what is the role of military medical support to humanitarian assistance and disaster response, as well as infectious disease outbreaks? The second is, how do military women contribute to this broad role? And the third is, what are some ways that your organization seeks to include and promote women as participants and leaders in medical support to humanitarian assistance, disaster response, and infectious disease crises? A quick note also for the audience, don't forget to use the Q&A feature in the bottom of the screen, as we will be having about a couple minutes towards the end of the panel to go over any audience questions. So I'll turn it over now to Rear Admiral Miller to answer this first set of questions.
Hi, hello again. And so basically in response to the first part of the question, our U.S. national security strategy recognizes that global health threats constitute a growing risk that really transcends geographical and political boundaries. Global health engagement, or GHE, is the U.S. military's platform really to address these threats. And it includes response to extreme weather. It can be natural disasters, infectious disease outbreaks, really any disasters. As members of the U.S. military, we always serve in support functions to our Department of State and USAID partners who lead these efforts in close coordination with our host nations that are requesting assistance. DoD is uniquely positioned because we have both the assets and the experience really to deploy necessary relief personnel and resources really around the globe on very short notice, which makes us exceptionally well suited to respond in times of crisis. When it comes to women's contributions to military medical support, it's important to kind of highlight a couple of the points that have already been made. And how the U.S. sits is that although women constitute 70% of the world's healthcare workers, therefore they really are the bedrock of global healthcare. This means that they're also on the front lines of the medical response every day in crises. Similarly, within the U.S. military specifically, a larger percentage of women are represented in the service participating in the medical healthcare fields compared to men, and they can serve in every available occupational specialty in every available leadership position. So our military medical community really relies strongly on women's participation. We contribute 50% or more than 50% on the deck plate piece of the execution of the medical mission, and we are extremely well represented amongst the leadership roles as well. We make critical contributions alongside our male colleagues, both in steady state operations and also when we're deployed for crisis response operations. And I'll just use an example of our recent response, both in the AOR and in our own country to the COVID crisis has really highlighted this. Around the AOR, similar to our partners that have spoken, we've deployed, whether it's some personnel, material, resources, logistical support around our AOR, and women have been involved in every piece of those planning teams and operations, both inside here, the PACOM headquarters, as well as throughout our components, very well represented in the planning and execution phases, so playing critical roles. Additionally, just in our own country, for our own humanitarian assistance response, or what we call defense support of civil authorities here in our country, I was particularly engaged in that because the DoD led a significant piece of that effort, and we most definitely had females leading in every capacity of that response, whether it was on our hospital ships, boots on the ground in New York City or across our nation, executing vaccines, whatever the case may be. And the reason that that's important, as in all disaster response, we had there a population of women and children, et cetera, that are high-risk subpopulations, and they require people that are particularly attuned to their unique requirements and what is posing them at a particular risk when you both plan and execute an emergency response operation. So this is why the Women's Peace and Security Agenda is really so important and necessary for organizations to continue the part we play in advancing the goals. And our Department of Defense wants to expand our WPS engagement with our counterparts around the world to share lessons learned and also develop strategies to more effectively engage women and as both necessary and equal partners within the security sector. And with that, I'll close my comments. Thank you.
Thank you so much, Rear Admiral Miller. And yeah, you're exactly right that global health threats do constitute global risk. And thank you especially for noting that point about including women across all phases of development and execution of strategies. I think that's something that often people tend to forget or sideline, is that they'll often include marginalized voices towards the end of something or maybe a monitoring evaluation, but not at the very beginning. So that's an excellent point. Thank you for raising that. Finally, we'll turn to Surgeon Captain Gautam to answer these first set of questions.
Yes, okay. Thank you, Mr. Lal, for your question. Well, I think our military, or rather our armed forces, the Army, Navy, and the Air Force, are always in the forefront during a national or an international crisis, be it the Indian Ocean tsunami, as mentioned earlier in 2004, the devastating Kerala floods back home, the Gujarat earthquake, or our rapid response in the cyclone in the Madagascar, or evacuate the strife-torn people from Yemen during the Yemeni crisis. In fact, of late, the Indian Navy has been the first responder of humanitarian and disaster relief in the Indian Ocean region. And just like when countries across the globe responded to the current pandemic of COVID-19, so did India. The Indian government deployed the military personnel and their capabilities to support this crisis response. Our resources, both human as well as material, were activated to assist the overwhelmed hospitals and the civilian organizations by creating additional hospitals which were manned by the doctors, nursing staff, and the paramedics of the armed forces. The military support also included transportation of medical supplies, development of healthcare workers, drives, and sending materials on different locations, disinfection of the hospitals, and numerous vaccination drives. And I must admit here that in all these things, the women officers were equally involved in each and every step, right from the leadership and planning role at the Integrated Defense Staff and at the Office of the Director General Armed Forces Medical Services, to evacuation of tasks, execution of tasks, and crisis response at the command level, as a command medical officer, as commanding officers of smaller and larger hospitals on ground, where women proved their mettle. In addition, the numerous women officers were deployed as first line of defense in the battle against this crisis, and along with their male counterparts. Also, as in the Article 14 of our Constitution, which states social equality for both the genders, Women leaders and frontline female healthcare workers have shouldered the responsibility and stayed ahead in this crisis by constantly adapting to the changing situation on ground and working towards the betterment of the community. The women officers were organizing quarantine and treatment facilities, conducting sanitation drives, monitoring surveillance drives, carrying out contact tracing, training and educating personnel with leadership that is cooperative, empathetic, and has transparent communication. Women leaders and volunteers and young women volunteers also provided assistance in meeting with the shortage of masks, delivering of sanitary napkins, spreading awareness about the virus, disease, and the vaccines, among other things. So I personally feel that the women bring a wider perspective to the humanitarian, social, and economic issues, and hence their participation in planning, decision-making, and combatant roles should be not only be increased, but also supported and sustained, as we have seen, hearing all the other panelists, how the women have been in the forefront in all spheres. Thank you.
Thank you so much, Surgeon Captain Gautam. You're exactly right. I think that issue of sustainability is where we often tend to struggle. I think there's always a push at the beginning, but then we languish very quickly unless there's sustained political will, and that's the hardest part. So thank you so much for this first round of questions to all the speakers. I think it kind of the role first off of military medical support to humanitarian assistance and disaster response, infectious disease control is very clear, as well as the role that military women are playing in this. So that's really good to hear. I'd like to spend this second round of questions diving a little bit more into the issues of gender equity and the importance of gender in all of this. So I'll introduce a second set of questions. Once again, feel free to respond to all of them or one or two of them in however you feel fit. So the first sub question is, in your experience, why is it important to consider gender in medical support to humanitarian assistance, disaster response, and infectious disease decision-making, planning, and response? Can you provide an example of how gender considerations impacted your medical mission? And how can we achieve a more gender-responsive approach? All right, we'll turn over to Ambassador Williams to answer the second set of questions.
I think Surgeon Captain Gautam outlined the critical rationale for why it's important, the perspective of gender perspective is critical in all stages of the cycle of planning and delivering healthcare. And women need to lead, to deliver, to have a say. And I say that thinking about from the community's perspective, being able and needing to see themselves in the leaders and providers of healthcare. And I say that also thinking we have much further to go in the diversity inclusion agenda in health leadership and having a say in delivery. We can get to a certain point with gender, but we have to not stop there. And I think the organisation, the Women in Global Health, who have done a great job measuring, advocating, and charting pathways for women in global health leadership with that stat we often use, which is so powerful. Women deliver 75% of care, but lead only 25% of it. Now, the question is about the importance of that gender lens in infectious diseases. And just last night, I was reading the Malaria No More report about why taking a gendered lens to malaria investments is so important. And for us in Australia, that has a historical interface with our military medical support in malaria control also. And again, part of the power of that report is articulating, one, the 10-to-1 economic returns on investing in community health workers for malaria control, a recognition that the unpaid work is unfair, and then the evidence that, say, female-headed households are more likely to buy and use mosquito nets, and where women are decision makers in their household, that household is 16 more times more likely to use a mosquito net for most of the last 8 months. So, I mean, I know we're talking about a specific subsector of medical missions, but really the factors that determine infectious disease are broader than the CIV-MIL interface, and that planning needs to be integrated from the ground up. The question also asks for examples, and I have a couple of where I think we have done well as Australia, and I think where we could have done better. So firstly, it's now established embedded practice in our humanitarian response that sexual and reproductive health Kits and needs are first off and core parts of anything deployed. Second part is that in our AUSMAT, Australian Medical Assistance missions, which occasionally include the defence integration as well, most of our deployments have women in equal representation, and many, if not more than half, have been led by women in the last decade. I think when I look at COVID, I think it's taken us a long time to see the people side of COVID. I think we started with a pathogen focus in our infectious disease response, and bringing the human element and the care and the outreach to our COVID response grew over time. When I think about DFAT's international health assistance for COVID, some of the good things, we deployed public health support across the Pacific in the first month of 2020. And when I quickly thought last night, who did we deploy? All of our public health deployees were women. So this is yet another arm of the outreach and the skills that we as Australia is sending and engaging and partnering with the region. But I don't think we talked about being more gender responsive in what we funded and delivered in laboratory strengthening, in surveillance support, in planning. And I don't think we measured or were deliberate enough in how that actually played through in the crisis. And now, as we are at Australia delivering a big regional COVID vaccine program in the region, what I'm seeing is that we've got great early coverage data for vaccine, but it's one, not all gender disaggregated, and two, where we see gender, men are getting more COVID vaccines than women, which doesn't make sense for the priority workforce cohorts that we know should have been the principal recipients of the first lot, which is female healthcare workers. Now, of course, there are many reasons to unpack there, but coming back to that example, I'll finish like I did in the first question. We've got much further to go in putting our action into measurable results. Over.
Thank you so much, Ambassador Williams. And first, really, thank you for being, reflective and open with the fact of what maybe didn't get done, which is making sure to be really focused on being gender responsive in what was funded. And that's an important self-reflection to kind of ensure that we're moving forward. And you're already seeing the results, as you mentioned, of, not seeing sex-targeted data in terms of vaccine response. And that's a key finding, and something that I'm sure others will also take back about making sure that the funding is also looked at in a gender responsive lens. That is critical. Next, we'll turn over to Mr. Noguchi to answer this second round of questions. Mr. Noguchi, over to you.
Yeah, thank you very much. And I respond to the second question, the importance to consider gender in medical support to humanitarian assistance and disaster relief. In the field of humanitarian assistance and disaster relief, affected people have a variety of backgrounds, and both male and female can be affected. So it is important to make a decision, to make planning from the various perspectives. And in addition to the search and rescue in the operation, the self-defense force aims to support the lives of affected people in a responsive manner. And also, self-defense force has to respond to various needs of the local community, local government, including water supply or bath or shower. And also, female self-defense force personnel plays a very important role to identify the needs, specific needs for women. And in 2011, we suffered a lot from the Great East Japan earthquake in March 2011. And female self-defense force personnel went to the site field and had a series of interviews with affected female. And they were able to identify what their needs specific for women. And then female self-defense force personnel were assigned to hand over those materials of specific needs for women. It's a sensitive operation. And also, self-defense force personnel were dispatched to visit evacuation centers. Those personnel specialized in counseling, and they were able to listen to the voices of affected female, their anxiety, their feeling, or their desire. And this effort was able to contribute to alleviate the stress caused by the long-standing evacuation center life. And in 2009, when a big earthquake hit off the coast of Padang in Indonesia, self-defense force has dispatched emergency medical team, and female doctors were dispatched to area in which the majority is Muslims, and affected females were able to receive medical treatment in a relaxed manner, and that effort was highly appreciated by the local community. I stop here. Thank you.
Thank you so much, Mr. Noguchi. I think the example that you give is really helpful to kind of think about what we're talking about here when you talk about the 2011 earthquake experience to how female personnel went to the sites and led interviews with affected females to identify their unique needs and then followed up to actually deliver those materials. So that is a perfect example of exactly how to be gender responsive and why that's so important. Thank you so much for that. Again, as in the last round, let me just quickly go through the questions one more time for the audience to be able to remember what we're discussing here. The first sub question is, in your experience, why is it important to consider gender in medical support to humanitarian assistance, disaster response, and infectious disease decision-making, planning, and response? Can you provide an example of how gender considerations impacted your medical mission? And how could we achieve a more gender responsive approach? Rear Admiral Miller will return to you for the second round of questions.
Okay, thank you very much. And I'm so glad you asked about gender considerations, because simply increasing the number of women participating in the security sector doesn't guarantee a gender perspective in our missions. At its core, a gender perspective means understanding that men, women, boys and girls and gender minorities have a unique experience and therefore unique security needs and interests and must be considered on their individual basis. We need to take these considerations into account in a proactive manner when we plan and execute our military operations. When it comes to humanitarian assistance and disaster response efforts, there really are a number of key gender considerations to be aware of. Women and children are 14 times more likely to die from a disaster. That's a staggering statistic. This is due to a wide range of reasons that vary from one society to the next due to variables, but they include gender norms, such as the fact that men and boys learn swimming and to climb trees in some cultures where women don't, and when they're prone to flooding or hurricane, tsunami, and flooding efforts, it's put women at a significantly increased risk, or the propensity for women to be involved in domestic labor indoors, which puts them at a higher risk and more vulnerable during earthquakes. So the factors change from society to society, but they remain in existence. Women and girls are they also experience the aftermath of a disaster in different ways, including unequal access to aid and healthcare, exacerbating entrenched gender inequalities, such as women and girls being the last to eat, for example, in some cultures, an increase in gender-based violence and exploitation that also occurs. COVID-19 has really illustrated the gendered nature of pandemics as well. While women, being 70% of the world's healthcare workers, they're immediately and disproportionately put at risk for infection, as were all the other frontline workers where women are overrepresented. These include like cleaners, supermarket workers, teachers, childcare workers, all disproportionately at risk. The pandemic also resulted in an increased incidence of domestic and gender-related violence, with many women actually trapped indoors with their perpetrators due to lockdown orders. And this was compounded by the fact that they had a reduced access to emergency services during the COVID pandemic. So the fact that this constellation of variables really puts women in a disproportionate fashion. For these reasons and more, it's really very critical that women are involved in disaster risk reduction, resilience and response efforts, as well as planning for infectious disease outbreaks. Without their perspective, we really risk overlooking unique needs of half the population. At any time we're dealing with the human population, we're dealing with gender. So it's important to understand how gender dynamics affect really everything we do. To this end, another excellent way to achieve a more gender responsive approach is by designating, training, and deploying military personnel as gender advisors and gender focal points to really help integrate gender considerations across all of our operations, not just medical ones. At Indo-Pacific, we've trained over 100 personnel from a wide range of occupational specialties to consider gender as a key identity characteristic to inform our military planning. We have both women and men who serve in these capacities. And through specialized coursework and programs of training, they learn how to conduct gender analyses with military missions specifically in mind. Once folks see how gender affects our operations, it almost seems like common sense to include gender in the planning. But without practice and deliberate inclusions, gender perspectives can otherwise be easily overlooked. So this is a learned skill set, which means everyone, not just women, can develop and apply a gender perspective. And the more folks we have that are trained to do this, the more familiar it will be. And then it will just be in the DNA of how we conduct business. And I just want to spend 2 seconds saying an example is we conducted a military operation in another country for medical acute trauma and medical care. And we had to learn early on that in some cultures, women cannot be unclothed in front of men that they are not married to. That has disastrous effects for them in their own society, to the point that they would refuse medical care. We learned from that. And then we started proactively planning for female teams and things that would shield the patient to accommodate all these requirements and then be able to provide the care we intended to provide in the context that they could actually receive it. Thank you.
Thanks so much, Admiral Miller, for that excellent example at the end about involving female personnel, but also really importantly for dispelling a long-standing myth that gender equality is only about women and should only involve women. Your point about the need to involve men and boys as well and their perspectives in response. You are exactly right when you say that when we look at populations, we're looking at gender inherently, and that covers everyone's gender, and we're all better for having gender responsive strategies and approaches. And so I like your suggestion as well about gender advisors. That is key. So thank you for raising all of those points. Finally, Surgeon Captain Gautam, we'll turn to you to wrap up this second round of questions.
Yes. Thank you, Mr. Lal. Am I audible now? Yeah.
Yes, you are. Thank you.
So, definitely, I would strongly agree that it is important to consider gender during medical support and HADR decision-making and planning. Though I believe that the skills practiced by the women to navigate through a crisis are generally the same as the male counterparts. That is, the ability to present an inspiring vision for the future, create clear expectations and optimism around the implementation of the vision, and also to lead by example. But definitely women have a greater tendency to demonstrate empathy, transparency, and nurturance. Even researchers agree that women leaders positively affect performance simply by guiding, inspiring, and engaging their peers and subordinates in personal communication, leading to a participative decision-making. Well, I'd like to give a personal example here. When I was deployed on USNS Mercy, in a first, I was privileged to be nominated by the Indian Navy for this challenging deputation to represent India along with 6 male officers and a few paramedics. It was a lifetime's opportunity, which I was happy to grab, and I cherish it till today. Mercy was on a humanitarian mission and held medical camps in islands of Philippines, Bangladesh, East Timor, Indonesia, and many more. So we interacted and treated the grief-stricken people on these islands who looked up to us doctors as, grief-stricken islands with caregivers with feelings bordering on reverence. The ladies and the children would be in awe of all the lady doctors and the nursing staff and would open to us freely, more freely than the male counterparts for some reason. The healing touch provided by the women officers with empathy and compassion at times is a notch higher than other gender, I believe. Therefore, we need to have more women inducted into the military and give them equal opportunities like the male officers. In fact, this has already been kickstarted in the Indian Armed Forces, where after a gap of 20 years, women officers are being once again deputed on afloat platforms. I was the last one probably in 2000 when I disembarked from the ship. And now after 20 years in 2020, women officers have again getting posted to the ships. And they are getting posted to field areas as combatants and are also flying fighter planes. The UN peacekeeping mission from India has the largest number of women officers, nursing officers, and lady medical officers. The Indian government has recruited women in the military, police, and the paramilitary forces like the BSF, the ITBP, the Central Reserve Police Force in junior ranks, which is a creditable and a very big step forward. Also, in a landmark Supreme Court judgment, the short service commissioned officers in the armed forces will now be granted permanent commission. This is a corrective step taken towards women empowerment and gender equality, which is the need of the hour. Major infrastructural and transformational changes are being made for the future deployment of the women officers, and this, I feel, is a very gender-responsive approach for the government. Thank you.
Thank you so much, Surgeon Captain Gautam, and especially to your point, I think there is a lot that we can lean on for the different genders. They all have their own unique advantages and perspectives that they bring, and so it's important to kind of have a diverse team for that reason alone, let alone all the other reasons that our colleagues have mentioned today. Finally, we have a third set of questions. Before I go into this, just want to remind the audience one more time to please use the Q&A function below on the bottom of your screen to ask any questions of the panelists. We'll have about 10 minutes at the end of this session to answer any questions, so please do use that function. For this third set of questions, we have once again 3 sub-questions. The first is, what is the nature of civil military medical engagement with civil society organizations, especially women CSOs? The second question is, how can military better work with civil society organizations that represent vulnerable groups, such as widowed women, people with disabilities, indigenous ethnic minority communities, and displaced communities? And finally, what is working well and what could improve? Turning it over first to Ambassador Williams to answer this third set of questions.
Thanks. I'll offer just some very brief reflections here. I'm interested in the perspectives of the other panelists, actually. And the one reflection is just thinking about what's the right interface with community in a given context at a given time. And, for the fly-in mission, with no previous experience in a place or a location or with a community or culture, that can be very tricky to navigate. And I think they've been some really good examples of learning during the mission and now how to think about before that. And I think Admiral Pamela Miller made an excellent point around situating the military support or the civilian and military health response within a broader leadership team, so that no one's necessarily out defining their own engagement with civil society in an emergency response. And again, that plays into from where I see it, the development partnerships and the long-term capacity building, having that integrated from the outset. And the final reflection I had is that you asked about how we can do better, and we do have, and it's already been made many times, the point before, but gender focal points, gender advisors, integral to our team and thinking. And I think that's particularly important when we're talking in engagement with civil society. But yeah, I'll stop there, and I'm really interested in the actual experience of the other panelists.
Thanks so much, Ambassador Williams. And I mean, I think you bring up a good point that honestly, at the end of the day, some of this stuff, it's not novel rocket science. It's repeating over again, making sure it's done, that we have gender focal points, that we have gender advisors. It's something that we've known for a long time, but again, going back to the previous point, it does require sustained political will, and that's something, and funding and execution and all strategies. So I still think it's good to keep repeating it and hounding that point wherever we can. We'll turn it over now to Mr. Noguchi to wrap up this third set of questions.
Okay, thank you. In the field of humanitarian assistance and disaster relief, there are several players or actors, such as local governments, civil society organization, non-profit organization, and volunteers. And the self-defense force has to work very closely with these actors and players, particularly in order to identify the specific needs of the local communities. In Japan, when we have a large-scale natural disaster, first responders are self-defense force. But after the initial stage, we have to move or shift to the reconstruction phase. And the self-defense force has to withdraw in the reconstruction phase. And in the reconstruction phase, the local governments and the private sector are playing more important role. And this smooth shift, transition, seamless transition is very important. And last year, when the self-defense force was engaged in border control assistance, including enhancing quarantine measures, after finishing the first or initial stage, we transferred to the private sector or local governments the task or operations. And it was very smooth and successful. And in the reconstruction phase, yes, those actors should play an important role. And also, I would like to point out that to task out those operations to the private sector is important, because to stimulate the local economy, actually the service of self-defense force is free of charge, but in order to stimulate the local economy, economic recovery, it is indeed necessary the reactivation of the local economy counting on the private sector's economy. And talking about the large-scale vaccination centers that I mentioned earlier, nurses of the self-defense force and the nurses of the private sector are working together jointly. And also, I'd like to mention the case of Haiti, a big earthquake in 2010. And the self-defense force dispatched emergency medical team. But well, Japanese self-defense medical team learned a lot from the experience of JICA medical team. JICA is Japan International Cooperation Agency, a government affiliated agency, and they had been conducting medical activities before the self-defense force medical team. And we learned a lot, and we operated for 20 days. And after that, we transferred the operations to the Japanese Red Cross medical team. And this seamless Japanese operation was very successful. And also, the self-defense force medical team worked very closely with the international NGOs medical team, which were operating in the same site. And when those medical teams are not able to attend Haitian patients, the self-defense force medical team accepted those patients. This kind of collaboration worked very well. And I stop here. Thank you very much.
Thank you so much, Mr. Noguchi. You're right that it is collaboration at the end that makes this work, especially not just with public sector partners, but also private sector partners, to have that seamless transition and move on for the different roles that the different actors have the best experience with. So that collaboration is absolutely critical. Once again, let me just restate the third set of questions just for the audience as well as the two remaining speakers. What is the nature of civil military medical engagement with civil society organizations, especially women CSOs? The second question is, how can the military better work with CSOs that represent vulnerable groups such as widowed women, people with disabilities, indigenous and ethnic minority communities, and displaced communities? And finally, what is working well and what could improve? Rear Admiral Miller, will turn to you for this third set of questions.
Okay, thank you. Well, when it comes to U.S. military support to crises overseas, we tend to get called in after an event has already happened. So we want to make sure we've got the best information that we can have at our fingertips regarding the current situation when we deploy. No one knows a crisis better than the local affected populations and those who've been working alongside of those populations long before the crisis emerges. So this is one of the many reasons engagements with CSOs is so important before, during, and after a crisis. It's way more advantageous to have those relationships well established before a crisis occurs. CSOs are active within the host nations long before any disaster hits, which means they can help provide critical on-the-ground information and the context to foreign nations that are coming in to provide support. This unique understanding of the perspectives and the lived experiences of the different segments of the population, such as those vulnerable groups, is priceless. Members of these groups know best really what their security challenges are and what the needs are following a crisis. So it's therefore critical to hear directly from them or from their organizations like the CSOs who work directly for them and with them in order to develop inclusive response strategies. A number of organizations are already including gender considerations in their assessments and reporting currently, and these analyses can serve as a very helpful starting point for military personnel who are most often joining this event after the crisis has struck, especially with trained gender advisors and gender focal points on board who will need to consider how the gender dynamics will affect our military mission sets and how we execute those. Our interagency partners within our U.S. Embassy country teams work to develop relationships with different CSOs before a crisis, but preparation is the key really to the effective response effort. We should always be examining our disaster preparedness and response exercises to make sure that we're being inclusive of an entire affected population. You know, we kind of say we train as we fight, or we try to train as we would like to execute a disaster response, and therefore you want to cover the entirety of the population served. We should really ask ourselves, though, whose needs are being heard and how are those being prioritized? That's the first part. Secondly, whose are being overlooked. And that requires a concerted effort to really study your at-risk population. Who can we partner with to provide a more complete picture? And that's where the CSOs come on board and can really help complete our picture for a whole effect. And how can we better integrate these perspectives into our response? And so I just kind of want to highlight in closing on that really this is a continuous circle of a disaster response effort where the critical planning and the networking and the relationship building clearly happens before a crisis happens. And we really ride on the backbone of that network and that relationship, which is conducted in partnership with our country teams in the embassy, because we're typically jumping in after the crisis starts. And so we rely on our partners in all of this and the interagency effort to knit those relationships together and allow us to capitalize on those to plan and prioritize our response efforts. Thank you.
Thank you so much, Admiral Miller. And yes, I think it cannot be stressed enough to ensure that CSO engagement is done well before a crisis, and that's true with gender. It's true in all other types of crisis response. So thank you for raising that important point, especially to highlight the on the ground lived experience of vulnerable groups. There's no better way to do it than to engage civil society before a crisis hits. So thank you for that. Finally, we'll turn to Surgeon Captain Gautam to answer to wrap up this third set of questions.
Thank you, Mr. Lal. Well, the civil-military engagement with the civil society organization and especially the women CSOs is kind of a two-way system in India. One is the direct involvement of the military with the civil organizations. The military took on a wide range and a variety of roles in the national response. These ranged from setting up field hospitals to delivering protective equipment and oxygen cylinders to the civil population. Here, the trend with respect to the civil-military engagement observed was a blended civil-military response. Civil leadership with a military support in organization, logistics, air repatriation, and emergency field hospitals. Often thought as the last resort, the militaries, especially the Indian Armed Forces, have become a preferred response in humanitarian crisis, health emergencies, and the pandemic preparedness, as presently witnessed during the current pandemic. And during all these activities, the women officers, and the women CSOs have been equally involved and committed to the cause, which we are witnessing now. The second way in which the military, or rather I would say the women married to the military men, are involved with the civil organizations is an indirect form through the NWWA, AWWA, and AFWWA. Now, what are these? This is the Naval Wives Welfare Association, the Army Wives Welfare Association, and the Armed Forces Wives Welfare Association. These are small, like NGOs, which themselves are NGOs by themselves, which are by the women, for the women. And these NGOs work for the welfare of the spouses, children, and dependents of the military personnel. They not only empower the members for professional prowess, but also help in financial independence and entrepreneurship skills to get them suitable employments and jobs. So while the uniformed men are in the white are braving the high seas, and in the olives are guarding the frontiers and the borders, and the ones in the blue are touching the skies with glory, these women organizations work relentlessly towards achieving visualized objectives and goals, which are women empowerment and welfare, community support, development of academic and vocational skills, rehabilitation of widows and families of deceased military personnel, social welfare, healthcare, and environmental conservation. The rehabilitation of widows, referred to as the Veer Naris or brave ladies, is the core focus of these organizations. While their dues and pensions are taken care of by the services, they provide the much required emotional and moral support to the widows to help them cope with the loss. These women NGOs also run outreach programs with various non-government organizations in the civil sector for charity and welfare. For example, the Earth Savior Foundation for serving the less privileged people and making every possible effort to protect the environment. They also look after the old age homes and the homeless, abandoned senior citizens, mentally disabled people, and deprived families are also looked after by these NGOs. Another NGO, the NAVA, the Naval Wives Welfare Association, works with closely is the Palna or the Cradle, which is a home for abandoned, homeless, and destitute children. The Army Wives Welfare Association helps and supports in functioning of about 37 schools for the differently abled children. The efforts are for integration of these children in the normal walk of life and making them economically self-reliant so that they lead a dignified life. So a step towards facilitating services to vulnerable groups such as widowed women, people with disabilities, indigenous groups, and ethnic minorities. A framework between the CSOs and the military has been created and should be created, which can be extrapolated to any and every situation where the military aid is required. The example in which epidemic situations, the military medical services can coordinate and accredited social health activist workers to extend the best facilities in remote areas and locations. This will generally aid in enhancing the overall healthcare in the underserviced regions. Thus, such a collaboration will prove beneficial to the CSOs, the military, and the population at large. Thank you.
Thank you so much, Surgeon Captain Gautam. And I like your point. I think sometimes we do forget about the spouses that are still continuing their lives on the ground and do need support. And this example of welfare associations by the women for the women to empower members for professional prowess as well as financial independence is a great example of thinking in a more gender transformative way for all of society, not just for those in uniform.
Yes,
for that. Thank you. So I think maybe while we're waiting for the so just as kind of a recap, we will have, please do use the Q&A function for all the audience members. Right now we have one excellent question right now that I'll pose to the speakers. If anyone else in the audience has another question, please do use that function and just type your answer and send it. You can also upvote those questions if there are others that you'd like to see answered. So I'll ask this first question by Beth Colina to all the panelists, and we can each take, we have some time so we can each respond to this question. How do you see the women, peace and security role expanding in international peace and security? So more, how do you see this movement for women, peace and security expanding in the broader field of international peace and security? I think we can start again with, in the same order, with Ambassador Williams.
I mean, I think progress is when it is just about international peace and security, and the identification as women as a separate part of that is no longer necessary, right? So, that maybe is the destination per se, but again, you know, my perspective is very on the civilian and development side of this. So I'm again interested in the other panelists' response. But yes, when it's mainstream, but then, you know, should it ever not be mentioned? I'm not sure. I'm interested in others' views.
Sure, Mr. Noguchi, do you want to chime in for this?
Thank you very much. And in Japan, we are now more and more conscious about the gender how to increase the people's awareness of gender balance. And we are focusing more and more on work-life balance. And previously in Japan, it was only female that was doing household works, but now more and more men are engaged in supporting family issues. And so, and also we have UN SDGs, Sustainable Development Goals, and one of the goals is also gender. And so in Japan, we are more and more conscious about this gender balance and women. And also in the international cooperation, we are very keen to gender issues. And self-defense force dispatches female self-defense personnel to the NATO headquarters to learn about NATO experience or NATO approach for the gender issues. And in this way, we, as the self-defense of Japan, is learning the international trend or international approach to highlight women, peace, and security in this way. Thank you very much.
Thank you so much, Mr. Noguchi. Over to you, Rear Admiral Miller. How do you believe this women, peace, and security role is expanding in international peace and security overall?
So that's a great question. First of all, I just want to say I think it's a testimony to progress when women, peace, and security, the importance and relevance is nested everywhere from our national security and defense strategy all the way down to our Indo-Pacific strategies and priorities, to where, and ideally we would get these specific initiatives developed and executed right in the line items of all of our plans and exercises. And to a point earlier, it would be great if we never had to differentiate this, but there will always be genders. And so much like there's other at-risk populations, I think we will always need to talk about it. And I think it's really important, though, to kind of like COVID, we're all in this together, because no one nation has this completely figured out just yet and has this completely wired. It's in development, and we're all at different points in our journey towards developing a more inclusive defense, and especially in our defense institutions. And it's important that we learn from each other. And that is why the Women, Peace, and Security agenda is so important, and why it's necessary for defense organizations to consider the part that we play in advancing broader WPS goals. Our Defense Department wants to expand WPS engagement with our counterparts around the world, and specifically to share lessons learned and develop our strategies together to more effectively engage women, both because it's necessary and the fact that we're equal partners inside the security sector. So at Indo-PACOM, we do look forward to exploring new avenues and an order of cooperation in WPS with our regional partners, and including areas related to military medical support to crisis. So it's an exciting time, much like everything that's new and initiatives, but to know that it's now nested and articulated at every level in our architecture, and that we're now having these types of webinars, and now we can look forward to shaping this going forward with our regional and global partners. Thank you.
Excellent. Thank you so much, Admiral Miller. Finally, last but not least, Surgeon Captain Gautam, if you'd like to respond to this question.
Yeah, I quite agree with what Admiral Miller has just said. In fact, she just brought up the whole essence of the thing, that why we really need to have more and more women in this WPS sector, because they are definitely, there should not be any gender bias or a gender, there should be gender equality. And women are doing well in every field, be it science, be it medicine, be it politics, everywhere. So we need to include them more in the defense also, and in the military. It is said, the hand that rocks the cradle rules the world. So I would say that women in the defense not only rock the cradle, they also wield a weapon. They march past on the Rajpath. They save lives. They dazzle at parties, and they they can sail on high seas. They fly, touch the skies. So women can be everywhere.
I love that. That's an excellent note to end this round on. Thank you so much, Surgeon Captain. Finally, we have time for one last question from Catherine Maxwell. It's a good one that's actually really more focused on the current COVID-19 response and previous crises, infectious disease crises. What are some lessons learned from your country's military medical response to Ebola, and how have they been used to combat COVID-19? So how are we, and maybe I might add in this question, how are we kind of adapting or learning from the gender responsive issues that we saw in Ebola to improve the COVID-19 response in your military medical response? We'll start off in the same order with Ambassador Williams.
So we all watched in the Ebola crisis, the cessation of essential health services and maternal care with great concern. And I think with international partners, recognise the dual health crisis, and so much effort was focused on the Ebola response. But it was not without effort in recognising the particular health needs of women during that crisis, and several agencies focused on that in particular. And Australia was part of the international response, and we said Ebola Treatment Centre, but it was really a coalition of partners who responded to the need to not lose sight of women's health issues. I think before then, we had institutionalised some of that humanitarian assistance and sexual and reproductive health and rights, as I said before, and we continued that as a first responder normal practice. And the COVID, we're learning as we go around the role of essential health services and the differential impact of a country's COVID response on the access for women to safe birth care, antenatal care, and routine immunisation, for example. But it is really difficult to keep the pedal on that when the attention is focused on another crisis. And so we're still working out actually the best way to turn our concern into action that does not neglect those critical health issues. Over.
Thank you so much, Ambassador Williams. And that dual crisis is a huge challenge, and I'm happy to hear your points on it, as well as the issue of trying to respond to COVID now when all the attention is focused on that and still maintain routine health services. Just a quick point, we are coming up on time, so I just want to make sure that the other three speakers, please do try to limit your response to about 1 minute. Thank you so much. We'll turn over to Mr. Noguchi.
Thank you very much. Honestly speaking, I don't have a lot of experience or knowledge about Ebola crisis. But so for Japan, this coronavirus crisis is something new and very challenging. And so we are now discussing if our approach was quite right or not, or Japanese emergency system worked well or not. So, and also we witnessed the supply chain risk, essential materials or medical equipment or vaccine, how we can supply ourselves, or these kind of discussions are starting. And so coronavirus triggered these discussions. And also, through our operations of humanitarian assistance, disaster relief during the pandemic in Japan, we try to share our experience, lessons learned with foreign countries. And for example, in Fiji, we have joint project with Australia to improve the Black Rock military base and for medical facility. And in the international cooperation, we would like to reflect the lesson learned through our experience. Thank you very much.
Thank you so much, Mr. Noguchi. Over to you, Rear Admiral Miller.
I think globally speaking, I'd like to talk about the impact of both. It's a parallel in both Ebola and COVID in terms of communicating risk to specific populations. And one of those being women and caregivers, because just like being a family caregiver and tending to ill family members in Ebola became a risk factor for people handling family members and physically providing care, the same thing occurred in COVID. And tried to lean forward hard. I think we did learn from Ebola, and we tried to lean forward with some more strategic communication of how to mitigate that risk and how to protect oneself in terms of, as you're trying to care for ill family members or your family members at risk, how to protect yourself in doing so. And I think women are just very specifically put in a higher risk basket because of the preponderance of the caregiving that happens. So I think it was lessons learned during Ebola that were applied during COVID and were helpful at mitigating that risk through some strategic risk reduction communication efforts. Thank you.
That's very helpful. Thank you so much. And finally, Surgeon Captain Gautam, if you'd like to wrap up this question briefly.
Yeah, that's just right what Admiral Mills just said. I would also like to voice the same, that we did go about during the Ebola crisis and the H1N1. We learned several lessons, which probably to be prepared and how to protect ourselves and how to keep ourselves safe and how to go about the entire surveillance and or tracing and treatment about it. And those learned lessons came in handy during the COVID-19 infection, which we are now handling pretty well. And I think it is just the two of them going together.
Thank you so much, Surgeon Captain Gautam. And thank you so much to all the speakers and the audience for the great questions, and the speakers for your wonderful responses and insights. What a rich discussion we've had so far. I'd just like to provide some brief closing notes on this event, and then we'll turn it over. We'll close with the Pacific Forum. So just a quick recap, we've discussed today the importance of gender-sensitive perspectives for effective military, civilian medical planning. We've also discussed the importance of engaging CSOs at all stages of a response, both before, during, and after, as well as the impact of the lack of sex disaggregated data on the ability to plan gender-responsive medical support operations. We also do see, though, there's a clear wealth of experience and knowledge in the field, as demonstrated by the speakers, which can be increasingly harnessed, shared, and promoted to improve crisis response outcomes. And as we've seen with COVID-19 and Ebola, we successively are learning more and more about this space. There is a need and importance for more academic practitioner collaboration and research in this space. So a lot more to be discovered and a lot more to be applied, hopefully, through these gender focal points and advisors at all stages of development, execution, and response to crises. Thanks so much, everyone. I'll turn it over to Crystal to wrap up, who'll close the final session.
Thank you very much, Arush, and thank you to our esteemed panelists and participants for joining us today. We hope you found this discussion of women's leadership in military civilian medical support thought-provoking and informative. We hope you'll continue staying engaged with Pacific Forum programming, which you can find out more about on our website, www.pacforum.org. Also, please note we have forthcoming women, peace, and security related research papers to be published in Pacific Forum's journal Issues and Insights, so stay tuned for those. I'd like to ask you to take a few minutes to share your feedback with us about this event by completing our post-event survey. You can find a link to that in the chat box now. Finally, I'd like to invite you to another Pacific Forum event happening tomorrow, June 30th, 2021, at 3 p.m. Hawaii time, so just 22 and a half hours from right now. The topic is maritime security and the environment, how women protect and defend Southeast Asia's future prosperity. You can register for tomorrow's event using the link in the chat box now. Thank you again to our participants, to our moderator, and our speakers for joining us today. I want to also thank our partner, US Indo-Pacom, for making this event possible. We hope to see you at future Pacific Forum events. Goodbye.